Good day, I welcome you back. Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome back to Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your ongoing pain. We're going to continue today on the topic of the two most common causes of migraines and headaches of many types. And I want to start today's episode by saying this. If you're looking for the next best new and improved pill, shot, potion, gadget, gizmo, in yet another attempt to try to manage your migraine and headache symptoms, you are in the wrong place. Because if you don't know what you're trying to fix, in other words, if you don't know the real, true cause of your migraine and headache symptoms, chances are you may never experience any significant long-lasting relief, no matter what kind of treatment or therapy you try. So, the commonsensical approach to medicine is simply this. Rather than trying things out, hoping for some kind of significant and long-lasting improvement, why don't we focus first and foremost on pinpointing the real true cause? This is Commonsensical Medicine 101. I will also say this. We discussed last week, among medical professionals as a whole, migraines and headaches of many types are treated or managed. Treated or managed. Look, we don't want migraines. When I battled migraines for many years, I would try just about anything to find some kind of relief. But I wasn't given the choice of addressing the cause. And many of you, if not most, are just simply not given the choice to pinpoint and address the real true cause. It's all about selling you, yes, I said it, selling you the next best treatment in yet another feeble, failing attempt to try to manage your symptoms temporarily. That isn't the only option. That should not be the primary option yet. That is the option that we're given. So as I say week in and week out, the only way that you are going to have a chance at experiencing some kind of significant, long-lasting improvement is for you to become the expert. We also discussed last week that either number one, our doctors just continue to ignore decades upon decades upon decades of proven, published medical research, or maybe more likely, your doctor is simply not aware of this extensive research. And as a practicing migraine and headache specialist for the past nearly 32 years, it's my duty, it's my obligation to you to know and understand the published medical research and scientific studies. It's my job to communicate that to you to help you become the expert. And the medical research for countless decades has continued to show that your migraines, your headaches, may not be a head problem, but rather pressure, what we term in my practice, spinal compression or spinal canal compression in the upper part of your spine, near where your head and your neck meet at the base of your skull. This has continued to be documented in the research as a primary cause of migraines and headaches, yet our doctors seem completely oblivious to this fact. So, last week we discussed among our medical professionals. That could be our primary care doctor. That could be a neurologist who, as I established a few weeks ago, is not a migraine and headache specialist, but rather a specialist in true neurological disorders. Pain management specialists, chiropractors, physical therapists. Among the medical community as a whole, migraines just happen to some people for no apparent reason. Or they confuse triggers with causes. Weather changes, hormonal changes, sounds, smells, those can potentially be triggers of our migraines, but absolutely positively not a cause. And we also discussed last week, according to decades upon decades of proven published medical research, not opinion. You don't need my opinion, and quite frankly, you probably don't need more professional opinions, because they are simply that, just another differing, just another conflicting opinion. You must become the expert, and according to the experts that have published medical research dating back to the 1950s and continuing to this day, the number one cause of migraine and headache symptoms is a neuromusculoskeletal disorder. Let's define that. A disorder that involves an abnormal shape or structure in the upper part of your spine that is physically compressing the spinal canal, resulting in neurological type symptoms. So, neurological disorders can be identified with neurological examination or imaging studies such as MRI. However, most of us that have battled or continue to battle ongoing migraines and headaches of many types have normal, so to speak, unremarkable neurological tests. They do not identify any abnormality and certainly do not identify the cause of our migraine and headache symptoms. It's not a neurological disorder you're battling. It's a neuromusculoskeletal disorder, a structural disorder compressing the spinal canal, resulting in neurological symptoms. Last week, we talked about cervical spine kyphosis with spinal canal compression, or spinal canal distress. And what that means is when we view your spine from the side on a simple X-ray study, your neck area should make a nice, smooth, forward curve shape, and it serves as a built-in shock absorber, like a built-in spring. So if we were to form our index finger into a curve shape and then push downward on our fingertip, it creates a springy shock absorber that would protect the spinal canal when we're talking about the neck and the upper part of the spine. However, if you were to bend your index finger backwards into the wrong direction that it's clearly and obviously not designed to bend into, and you were to hold that pressure, hold the pressure of your finger bending backward and never let go. That constant physical pressure, when it's applied in the upper part of your spine, will begin compressing the spinal canal, which, by the way, is pressurized, therefore affecting how your body responds to pressure changes such as weather changes, barometric pressure changes. This is how a trigger such as a weather change can actually bring on or aggravate migraine symptoms. The pressure in your spinal canal is already being affected by the backward bending spine compressing the spinal canal, which does not allow your body to respond normally to the barometric pressure changes. So that, by far, without a close second, is the most common cause of migraine and headache symptoms of many types that I've seen in my nearly 32 years in private practice, and that has been documented in decades and decades of published, proven medical research. So what is the number 2 cause? What is the second most common cause of migraine and headache symptoms that has been documented in the research and that we continue to see in our day-to-day practice? It's a condition that we call rotational malalignment disorder. What in the world does that mean? The top vertebrae in your spine that sits up underneath the base of your skull forms a ring. And the opening in that ring is where your brain turns into your spinal cord, and your spinal cord travels from your brain down into your neck and controls every single function. Not some of them, every single function of your body. So, when the brain turns into the spinal cord and it travels through the opening in this top vertebrae, and the opening in this ring, as long as there is nothing squeezing, compressing, or irritating that spinal cord, things should function as normal. All of the messages coming from your brain traveling to the rest of your body, as well as the messages traveling from your body back to your brain to tell your body how to respond to these external stimuli. Again, let's use the example of weather changes. Your brain will respond accordingly to weather changes. But if the spinal canal or spinal cord is being physically compressed, that can, and I'm going to use a word that's kind of an oversimplification, but it's almost like a kink in the spinal cord, and it causes a quote-unquote short circuit. So your body is not able to respond to these barometric pressure changes as it normally should, and migraine symptoms may result in rotational malalignment disorder, which is defined as an abnormal twisting of the top vertebrae in your spine, which acts as a torsion, a twisting pressure, which can affect pressure in the spinal canal. Let me give you an example. This is kind of a way to think of it. Cervical spine kyphosis, CK, or the backward bending of the normal forward arch shape of the neck, is by far the most common cause of migraine and headache symptoms. The twisting of the top vertebrae, I want you to think of it this way. If you were to take a cloth, a small towel, a washcloth, and run that under water and soak that cloth with water, and to get that water out of the cloth, you would wring that cloth. That twisting, wringing motion that produces that torquing and torsion is analogous to the twisting and torquing pressure that ends up on the spinal canal immediately where your brain is turning into your spinal cord traveling to the rest of your body. So, rotational malalignment disorder is defined as the abnormal twisting of the top vertebrae of your spine, which produces a torquing movement in the upper part of your spinal cord and spinal canal, and migraine symptoms are one of the most common symptoms that result from this condition. Now, I'm going to go a step further. Cluster headaches. For those of you that have ever experienced or are experiencing clusters or cluster-type headaches, I don't need to explain what that is. Sudden, sharp, stabbing, unbearable pain. The abnormal twisting the rotational malalignment disorder is the most common disorder that we identify in those with cluster-type headaches. And it is the second most common disorder that we identify in our patients battling ongoing migraine-type headaches. So both of these conditions that we discussed last week and that we're discussing today both have the potential individually to result in migraines and headaches of many types. But the most severe cases that we see in our office, the symptoms that are not simply "I have a headache" symptoms, these are unbearable, pounding headaches, feeling sick to your stomach, vomiting, brain fog, dizziness, lightheadedness. The symptoms are numerous. The most severe cases that we see in my day-to-day practice are those that have both a CK, the loss of the normal forward arch shape, compressing the spinal canal, and the twisting and torquing of the top vertebrae and the spine, resulting in compression and or irritation of the spinal canal. When you put both of those conditions together, the symptoms can be life-changing in a very negative way. It can keep you from doing simple, normal, everyday activities, from comprehending, so comprehension can be affected, speech, formulating speech in everyday communication can result. So again, individually, these conditions can cause severe migraines and headaches of many types, but when you put the two together, the symptoms can be detrimental to your normal everyday activity. So, how is rotational malalignment disorder properly diagnosed? Again, examination is critical. In my practice day to day, we perform neurological examinations, orthopedic examinations, spinal examinations, physical examinations. The examination findings must correlate with the imaging studies. And here's the great news: you don't need to run out and have expensive, fancy MRIs, CAT scans, because 99% of the time, those are quote-unquote normal. And if you've had these done already, I don't need to tell you this. The results are unremarkable. We do not see on your MRI or CT scan the reason that you're having migraines or headaches of any type. However, a simple X-ray, we call it an open mouth X-ray. The X-ray is taken from the front with your mouth open, thus the name. And the reason we have your mouth open is we're simply moving your teeth and your jaw out of the way so we can see through to the base of your skull where the neck and skull meet, at the base of your skull where the spinal cord begins. And again, we're not looking for broken bones or dislocations. In the medical community as a whole, X-rays are rarely, if ever, recommended for those of us that have had migraines or headaches, because they're reserved for broken bones and dislocations. We're not looking for damage to the bone. What we're looking for is a structural disorder of the upper part of your spine that would compress the upper part of your spinal canal, resulting in the migraine or headache symptoms. This is what the medical research has continued to demonstrate. This is what your doctor likely doesn't know. So, let me kind of conclude today by saying this. If you don't know what you're trying to fix, chances of finding any significant long-lasting relief are probably going to remain slim, and chances of your migraines or headaches worsening is pretty high. You can't leave that compression on the spinal canal week after week, month after month, and certainly not year after year without having some kind of either increasing symptoms, that is, more severe and more frequent migraines and headaches, but causing damage to the upper part of your spine, and it can absolutely result in irreversible damage if you wait too long. Don't ignore the cause of the problem. Focus first and foremost on pinpointing the real, true cause. Then and only then can we personalize a treatment plan, a corrective treatment plan, not to treat your symptoms or to attempt to manage your symptoms, but to address the cause of the problem, to remove the compression that's resulting in the migraines and the headaches in the first place. That can only be done not at a neurologist, not at your primary care. There isn't a magic pill, shot, or potion. There never has been, and there never, ever will be. But listen closely. You must seek the help of a migraine and headache specialist that is trained both in the proper diagnosis of migraine and headache disorders, but also trained to recognize and correct the specific upper spinal disorders that are resulting in the compression, thereby causing your migraine and headache symptoms. Common sensical medicine. Next week, we're going to get into two different things, and as a matter of fact, this is likely going to take us a couple of weeks. We are going to detail some of the medical research. I want you to know what the published medical research is saying and has said about upper spinal disorders of specific types causing your migraines and headaches, because we can't count on our healthcare providers and our doctors because they're oblivious to this information, and quite frankly, they probably don't care because it doesn't change what they do day to day. It doesn't change the fact that your primary care doctor is going to give you a prescription to attempt to temporarily treat your symptoms. It doesn't change the fact that your chiropractor is going to do spinal adjustments to try to get rid of your migraine and headache symptoms. It doesn't change the fact that the pain management specialist is going to give you injections. Doctors, therapists, and healthcare providers will do to you what they are trained to do, whether it addresses the cause of your migraines and headaches or not. We have a symptom treatment system, not a healthcare system when it comes to migraine and headache disorders. Thanks for listening. Please, I'm begging you, share this information, share this podcast, share my book with those you know and those you care about that continue to battle these ongoing migraines and headaches of many types. There are solutions, there are answers, there absolutely are identifiable causes. Your migraines and headaches are not happening for no apparent reason, and they're not happening because the weather changed or it's that time of the month or you smelled something. Pinpoint the cause first, then seek the advice of a specialist in both specific upper spinal disorders that result in migraines and headaches, as well as the proper diagnosis of migraine and headache disorders. Please let me know how I can be of help to you or someone you care about. Thank you kindly for listening. We'll talk next week. I'm Dr. Scott, your online headache doc, and those are the facts. And everything else, well, it's just another conflicting opinion. The information contained in this podcast is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's 32 years in private practice so far, specializing exclusively in migraine, headache, and upper spinal disorders, as well as decades upon decades of proven published medical research. Copyright 2025 by Milagros Media LLC, not affiliated with Dr. Scott's private practice.